Hi, I'm Bernard Walsh. I'm with the law firm of Shapiro, Goldman, Baboni, and Walsh. We're in Florida. I want to go into more detail as to my article part 2, as to understanding a little more about what you can do in a trucking case, either as a victim or as an attorney. Now, hopefully by now your attorney has sent in a spoliation letter, which can be obtained by contacting APITLA, APITLA. You can reach them at APITLA.com. What do you need to find out early on? And to understand that, you have to understand that the federal regulations involving truck drivers, which have been, for the most part, adopted by most states, are very specific in terms of the health requirements of truck drivers. So if your attorney or yourself download Federal Motor Carrier Safety Regulation 391.43, it talks about medical examinations and fitness records and annual physicals. Have to download, have to look at it, have to start building evidence as to whether or not there is a violation of the federal code as to the health of the truck driver. You have to obtain early on a list of all the doctors and healthcare facilities that the truck driver has seen in a reasonable period of time. I'd say go back 3 years, 5 if you can. Compare that to the annual report by the medical examiner that's been filed saying that he is fit to drive a tractor trailer. That has to be filed annually, but in there you obtain what the truck driver gave for his medical history and what doctors the truck driver has revealed he's seen. Why is that important? Because many times they do not tell the person or the doctor or the examiner, medical examiner, that's doing the annual physical all their medical problems or what facilities or healthcare providers they've seen. You have to compare the two. After you've compared the two, you must realize as you go through this that if you're asking questions of the truck driver as to what medical facilities he's treated with in a given state, you're probably making a mistake because they usually treat with different medical facilities in different states. So you have to become a little more creative in your discovery. My experience, and I think the experience of almost most of the people who do trucking litigation, would be that most truck drivers tend to be overweight. With that, they have associated medical problems that's associated with being overweight, such as sleep apnea, high blood pressure. Certainly, sometimes you will find that they have diabetes. Chronic spine problems are common, and depression. You will find by going through detailed review of the driver's medical records that many times they are prescribed medications, many times by different doctors, for these problems. What do you do with all this? Well, if there are a lot of different medications by a lot of different doctors, I like to have a toxicology expert review those to see if this person was in fact fit to drive a semi-tractor trailer on the date of the collision. I'll give you the Bernie Walsh rule of thumb for whatever it's worth. If you meet the truck driver and if the size of his neck appears to be at least 17 inches or greater, you should be pretty well convinced that if you dig deep enough, you will find problems involving sleep apnea and other medical problems that require medical care and medical treatment and medications. So if you follow my rule of thumb and you find the driver has a 17-inch neck or greater, keep digging until you find all the medical records. I hope this helps you. Thank you.